UPCF community, this is Brent again with Arasti, and today for our mobility and recovery series, we're going to be talking about the low back. This part 1 video, I'm going to be going over some kind of general principles with regards to the low back. The second video, we're going to be doing some mobility and exercises demonstration. And so I want to emphasize that this is kind of more generalized information with regards to the low back. Obviously, if it's more of a serious injury, you'll want to see a professional for that. But more generally speaking, in the low back area, people oftentimes get injuries here if they are not really stabilizing their low back and keeping a nice straight lumbar spine through their movements. And so oftentimes that's seen as doing like a kettlebell swing or lifting, and they're oftentimes getting too much flexion or extension in the low back rather than keeping a nice straight low back through those movements. And so ideally when we're doing movements such as a deadlift, a kettlebell swing, other lower body type movements, we should get a lot of movement, or most of the movement, from the hips, because the hips are designed to hinge. So that's where we should be getting most of the movement from, and we should get most of the muscle activation through these big muscles, the glutes and the hamstrings, which are designed to withstand high loads and be able to get us stronger. What oftentimes will happen for people that have low back injuries is they will get too much motion in the low back joints, and they'll also get too much activation of the muscles of the low back. And so this can lead to like a sprain or a strain type injury. And so like I mentioned, one of the best ways of preventing that in the future or recovering from that is just making sure you have really good form with and good technique with your lifts. And so getting the advice from others that maybe have more experience or knowledge, or filming yourself doing a lift can be very helpful to see if you are practicing proper technique. The other thing to mention too is with regards to the tight quadriceps and hip flexors, which I talked about in the previous video. And so if your hip flexors or quadriceps are too tight, what ends up happening is this muscle will actually shorten, and that will cause the pelvis to rotate forward. And that as well can put extra stress and strain in the low back. And so I want to reference you to my previous video series, which talks about the quadriceps and the hip flexors, as those are areas that definitely need to be addressed so that they're not causing this distortion in the pelvis. And so reference those videos, follow the mobility and exercise recommended in them, in addition to what I'm going to show you today with regards to the low back. And like I mentioned, if it is a more serious injury or if your symptoms are getting worse, I would highly recommend seeking the advice of a professional, as there are problems in the low back that could need more serious medical attention.